Hello, I am Dr. Saurabh Patil, Uro-oncologist, robotic surgeon, heading the Department of Robotic Uro-oncology Division at Fortis Hospital, Mulund. Today we will be discussing about the advantages of robotic surgery. So you must all be knowing what is robotic surgery. It's an advanced form of laparoscopic or keyhole surgery. What are the advantages of this robotic platform to the patient? Most importantly, because of these robotic advances, we are able to do more and more complex and difficult surgeries minimal invasive way with an additional advantages of greater surgical precision and good surgical as well as functional outcomes. Another advantage is the faster and smoother recovery. Patient is up and about on the same day of the surgery. We mobilize them the same day of surgery. We aggressively mobilize on the next day of surgery. They are able to climb up the stairs on the next day, and the post-operative day they can be sent home. Because of the earlier recovery, the chances of deep vein thrombosis as well as pulmonary thromboembolism also reduce, and the chances of going home also increases. We at Fortis Hospital also following an international protocol known as ERAS, that is Enhanced Recovery After Surgery Protocol, because of which we are seeing the dramatic improvement in the recovery function. After robotic surgeries, patients hardly experience any great pain and they are managed with simple analgesics with minimal complications, minimal side effects. And the requirement of analgesic is for very short term period. We usually don't prescribe antibiotics or analgesics even after the discharge. Immediately after surgery or during the surgery, the chances of complication, the short term and long term complication are much reduced. The chances of blood transfusion, the chances of patient shifting into the ICU is greatly reduced, and because of this, the chances of infection secondary to ICU admission or blood transfusion are significantly reduced. After robotic surgeries, they are resuming the work within few days. If we think in perspective of patient, the surgery, any surgery for that matter, is a stressful thing for them. And with robotic surgery, our aim is to give them the more and more comfort and this make this surgical experience less stressful and more enjoyable. What are the advantages to us as a surgeon? We can see a three-dimensional, much magnified vision during surgery, and if we can see small things better, we can spare those things, we can control the blood loss, and we can do surgery more precisely. There is another function with this robotic instrument. Here you can see the size of the robotics instrument. It is very small compared to our fingers. So these instruments can reach in hard to access areas like prosthetic surgeries where it is bound by the bony pelvis, and can do really good reconstructive work where in open surgeries with our hand it is difficult to reproduce. And also because of this small instrument and this endowrist multiple joint, the endowrist movement, we are able to replicate the open techniques of surgery beautifully during the surgery. So the reconstruction has been much improved, and which ultimately leads to or translates into better functional and surgical outcomes. For example, in radical prostatectomy surgeries, when we want to spare the nerves which are very small and tiny, we can spare because of the better vision and because of this tiny instrument. In partial nephrectomies, where we want to save the kid as possible, as much as possible, normal functioning parenchyma and take out the kidney cancer, in those surgeries also we can differentiate between the tumor and surgery. We can spare the normal parenchyma and we can beautifully reconstruct the remaining remnant of kidney. And lastly and importantly, about the cost of robotic surgeries. To be honest, on paper, the robotic surgery is a costly affair. If we compare with open surgery, it is costlier by about 1 to 1.25 lakhs. Compared to laparoscopic surgery, it is costlier about 70 to 75,000. But if we compare in toto, the chances of resurgery, the chances of re-exploration, the chances of patient being hospitalized for long period are definitely reduced. The chances of requirement of prolonged antibiotics, prolonged analgesics, or the need for ICU, the need for blood transfusion is significantly reduced, and because of that, overall cost is compared to other traditional open surgeries is definitely reduced. And most importantly, the cost and the stress which patient and his relatives are going through is definitely reduced with the help of these robotic surgeries. In last 5 to 6 years since my fellowship, I have been involved in more than 500 robotic surgeries, and to my experience, I have seen a dramatic shift in recovery and outcomes compared to open surgeries. And now we are discharging patient much earlier. with lesser complication rates, with fewer rates of readmission and re-exploration, and with minimum need for extra drugs like analgesics or antibiotics. In fact, we are not giving any antibiotics after this surgery. We give a simple analgesics for 2 to 3 days. When patients go home, they have only 1 or 2 simple medicines like multivitamins and laxatives. The good news for patient is the more and more insurance companies are also approving this surgery, especially cancer surgeries. So the cost to the patient is now again reduced. So to summarize, in last few years, robotic surgery has definitely progressed, and with the advent of new robotic platforms, I'm very sure that in future, more and more surgeries will be being performed by this robotic approach. Now we are doing mainly cancer surgeries with this approach and few reconstructive benign surgeries. But in future, once the cost is controlled, then we'll be able to offer this platform to almost all surgical fields. Thank you.